Hi and hello. I am Athena Pondian here. Welcome once again for all to all the participants, those who are attending this particular ultrasound training sessions. This is day three. This particular session, as previous days, the previous 2 days, this particular sessions is also give some of the extra knowledge to you about ultrasound. Same as that of Mr. Gautam will take care of you for this wonderful session, the last day session. Many of them yesterday during the question answer session, many of them have some of the requirements. These are all the things we need, like that you are asked to Gautam. So we discussed about what are all the things required for you. So we discussed about that, and I asked the Gautam to say something about what they are expecting about, what their requirement, all the things. So most probably the hardware and what are all the parts, electronics parts that is involved inside the ultrasound machine, and how far this particular parts are functioning, all the things he made explain today. At the same time, how you can able to handle this particular ultrasound machine with care, and what are all the certificates you need to take over if you are using the ultrasound machine. So all the things Mr. Gautam from the flips, he might have he might have explained about all these things. So thanks a lot for this particular session. I welcome you all once again, and thanks for my sponsors, and thanks to Mr. Bia and Mr. Priya from the leading companies, and thanks a lot for this particular thing. I hope I already told you the recorded session of all these three days training series will be reach you during, along with your certificates, along with your materials, and along with our PDF files. Okay, so use that properly. And if you have any clarification on once the training is got over, also you have my number, and you can able to ask me regarding this particular ultrasound. We are waiting for answer your questions, whatever the time it may be. Okay, thanks a lot. I hand over the session to Mr. Gautam. The Gautam will take care of this particular session. At the end of the session, we will meet you. Thank you very much.
Very good evening, guys. Thank you so much for coming for today's session as well. So, on to before moving on to slides, I was really happy that yesterday's session was, really interactive, and I have included a few slides that participants were asking about me, so I have included, and I'm very glad to share my knowledge and doubts regarding that. And so in today's session, I'll be telling you all how to maintain an ultrasound, and what is PNDT, why PNDT is very important in this ultrasound, and if someone is going to start a business on ultrasound, how they can able to do business on ultrasound. So I'll be giving a detailed explanation on that, so it will be very helpful for you guys. So you just have all your questions, and you can ask me at the end of the session, and I'm looking forward to answer those questions. So without any further delay, let's get started with these slides. Okay. So okay. So let's get started. So first thing is steps to maintain ultrasound. How to maintain an ultrasound? There are here I have given few steps, and I'll explain you everything clearly. So first thing is read the user manual guidelines. See, though the application specialist, then the salesperson, then there will be a tech support, then there will be a sales engineer, service engineer. Everyone will give you an ideology about the ultrasound, but they will have their own perspective about the ultrasound in their own way. Each one will give you different information according to their own knowledge, but it is your effort that you have to read the manual and the guidelines that has been given for each and every ultrasound, and you should know about that. And see, according to me, A user manual is very important, and not only for reading like how to use the machine. It will also help you if there is going to be any problem in that machine. It will help you to handle it by yourself, instead of calling for each and every time. If it is going to be a very simple problem, sometimes for example, the system goes off immediately. So what you have to do is you have to try switching on and off button. Sometimes it will come or it may not come, but you will know these basic things only if you read the user manual. If you are not reading that, you will not get a clear cut idea about it. Then the second one is use the machine properly. How to use a machine properly? See, every machine has some threshold level. You should not use the machine like day and night continuously. No, there is some threshold level. There is like this many scans you can do per day, or you should know how to buy a machine for according to your usage. If you buy like a Clearview 350 machine and all, it's a very small machine, and the capacity for it is you can scan around like 20 scans, or like 25 scans or 30 scans per day. But when it exceeds more than that, like 40 scans, 50 scans per day, automatically the strength of the machine comes down, the duration will come down. So you should use the machine properly in a regular basis, and you should know how to maintain that machine. And that's what I'm trying to say, like whenever you buy a machine, you should have a clear cut idea how much scan we will be doing per day. So if you ask the salesperson, they will tell you, see, this much scans I'll be doing per day, so I need a machine based on like that. So if you tell like that, they will give you the according to your usage, according to according to a regular cycle, they will give you the machine. Then third point is clean the machine daily. So as I said, I would have explained to you yesterday and day before yesterday also, probes plays a major role here. You have to clean the probes and keyboards and the trackball at regular basis, because you should clean that with the tissue. And sometimes what happens is those dust will go inside, and it will start giving the speckles in the image. So it will start producing like white lines, and then it will start giving like white dots in the image. So these are few things that you can neglect if you clean the machine daily. And after every usage, after for every patient, whenever you use the gel on the probe, you should wipe it with the tissue paper. And you should not use any other things like cotton, or you should not use like a normal paper and all. You should they If you ask the salesperson, they itself will give you tissue paper. They itself will provide you the gel, everything along with, while they are selling the ultrasound machine itself. So I don't think like tissue won't give much it won't cost that much, but it is the effort that you people take to clean the machine at daily basis. Then the fourth one is give the transducers extra attention. So whenever you use a probe, you should keep the probe where it belongs. You should keep the probe in the probe stand. You should not put the probe in the gel bottle itself. Some people tend to do that because they'll be very lazy to apply the gel in the probe and then to do scan. So you should not do like that. You should keep the probes where it belongs, and then you should give extra care. If you find any issues, if you find any scratches on the probe, you should call immediately the service engineer and ask them. And if you feel like that nylon or any of the that wire that comes out, you should not use cellophane tape, or you should not use any type of tape to rotate that and use it. No, you should not do that. You should either change the entire probe, or you should call the particular service engineer and ask them to change that nylon wire. Or if that rubber is coming out, you should not place the sellotape at the top, and you should not use the probe. The image of the You won't get a proper image if you use that. and the automatically the entire system or entire ultrasound gets to it will get damaged. So what you should do, you should give more attention to that. If the rubber is coming out at the top of the layer, you should ask the service person or anyone to change the rubber, I mean the change the layer entirely. And if you have issues with, mostly this issue will come only on convex probe and on cardiac probe, because those two probes are they'll use in a more they'll use more nowadays. I mean, the usage of convex and cardiac probe is more compared to other probes, and you won't get layer coming out in TV probe and all TV probe or ET probe or in 4D probe. The one major problem in 4D probe, what happens is the tip of the probe is made out of plastic in that. So in that case, what happens? Sometimes there will be a crack in plastic. So what these people will do, they will apply the gel in that crack itself, and then they will do scan on that. You should not do like that. So this might look like very petty things, but this might lead to a big loss. Consider if the doctor is buying a machine for 25 lakh rupees, the probe alone cost around like 5 to 6 lakh rupees. So if you're going to change a probe, and if there is going to be any problem in that probe, you have to change the entire probe. It's waste, the money is waste for the doctor. So giving more care to that is very important. So the next point is disinfection is very important. So what happens, why you have to disinfect it, which means sometimes you might take the ultrasound to operation theater. So whenever you do scans in operation theater, it is very natural that we used to get those virus and bacteria in ourselves. So we used to clean ourselves entire, we used to take bath everything. So but we can't use water and these things and all. So there is a liquid called OSM liquid, and you can spray that and you can disinfect the ultrasound machine. So it is also a very important thing. And whenever move an ultrasound machine from one particular area to another, consider like you're moving this ultrasound machine from an ICU to an operation theater, or from operation theater to ICU, check whether you have cleaned the ultrasound machine properly. Because from if you're moving from one place to another in hospital, it won't affect only that person's. It will become like an epidemic. It will affect the entire ward, or it will affect the entire place. So it is very important that we clean the machine at regular basis if we are using it in operation theater or in ICU. Next one is clean the air filters regularly. So what is air filter is, so there will be a small gap, like the if you see in AC and all, there will be a fan that will be set up outside. So same thing for these air filters are made to set up just to avoid the heat of the machine. So what happens in these air filters is that it forms a lots of dust. It will extract those dust away from the machine, and it will get absorbed from outside. So you should clean you cannot clean it. So you can call the service engineer whenever they are doing AMC and CMC. At that time you can ask them to clean the air filters, so it will be very helpful. Then take precautions during transport. So if you are going to do uh, if you are taking the machine in the ambulatory service, or you are going to transport a machine from one place to another, or you are taking to any hospital for any emergency cases, you should transport it in a very proper way. If you're failing to do that, what happens is, first thing that gets affected in the ultrasound is the monitor. The entire monitor gets collapsed. If you on the system, it won't on. Sometimes we have faced those issues when we are giving demos and all. So you should take precautions whenever you're doing any transport to the machines. You should close the entire machine with the thermocol, or you should use the tape, it's called a sticking tape. It will be like a glass tape. You have to close the entire machine with the glass tape, and you have to keep the probes in each box, and then you have to transport. You should dismantle the probes from the ultrasound, keep it in the box, and then you have to make a transport, and then get a regular maintenance plan. So whenever you buy a machine, you should get a maintenance plan. Either you should get an annual maintenance plan, or you should get a contract maintenance plan. Because you yourself cannot maintain the ultrasound or CT or X-ray at regular basis. The biomedical engineer, I'm not pinpointing about persons who are working in the hospital. They are really working hard. They'll be giving great care to the machine. I really appreciate that. But they should need the help from the persons, from the person who's selling also, right? From the consider it as if the person is getting machine from GE, or he's getting machines from Mindray or anywhere. So or in Philips, they should call the service people and ask them for maintenance plan. They themselves cannot do all the maintenance. Like, sometimes there might be issues in boards. If the machine has comes under like warranty or guarantee, they cannot open the machine and remove the board and all. It is the work of a service engineer. He has to do that. So it is possible only if you get a regular maintenance plan. If you don't get a regular maintenance plan, you won't have the idea what has happened there. So it is very much important that you get a maintenance plan. So this is how you have to maintain an ultrasound. If you follow these steps itself, you can maintain the durability of the ultrasound will be like, at least for around 10 years. I have seen a doctor who has used ultrasound on Toshiba. It was the first ultrasound that it was introduced in Toshiba. He bought like 20 years back. He's in Kerala. He's located in Kerala. He bought that ultrasound around like 20 years back, and still he's using. The only problem with the ultrasound is, sometimes there will be issue in the probe. He tend to change the layer of the probe, then he will change only the crystal inside the probe, like that. But the machine will be working fine. So it is the care that we give to the ultrasound or any machine at all. If we don't maintain that properly, automatically the durability of the machine will come down. So these are the steps that you need to know how to maintain an ultrasound. So then we move on to next slide. So HIPAA. What is HIPAA is? It is a Health Insurance Portability and Accountability Act. See, generally in India we have PNDT. In abroad they will say it as HIPAA. What happens in HIPAA is, for each and everything insurance will cover, because the cost of medicine is very costly in abroad, especially countries like America, UK, and European countries. Everywhere the cost of the health and health maintenance is quite higher compared to India. So health insurance, there are many insurances who pay for a patient's health well-being. So even if they are going to put a small injection, or even if they are going to take some drugs or tablets from the hospital, insurance will be paying for that. So it is where, so the American government has, it is very much concerned about the personal health, about each and every well-being. So they have bought this HIPAA Act. What this HIPAA Act is, the doctor or any personnel who's working in the hospital, they should not take any photographs or videos of the ultrasound or CT or X-ray, whichever they are taking. It should be maintained like, these things has to be maintained like confidentially. It should not. It is not. It should not be shared in public or for any other things. If it was done like that, it is called as HIPAA Violation Act, and there will be a severe punishment for that. So American government has bought this act just welfare of the American citizens, and this HIPAA Act has been implemented almost in all the countries. So next one is PNDT. So as I said, like PNDT is a very important thing that everyone has to know when it comes to ultrasound. It is called as Preconception and Prenatal Diagnostic Techniques Act 1994. This act was published in the year of 1994, but it came into existence on the year of 1996 only. So what happens is, generally the doctor should not say the gender determination and the procedural techniques like chromosomal abnormalities or sex-linked diseases or genetic disorders or anything. See, generally, what happens is why this act was bought in India is because many girl child has been abolished. They have been aborted. So for that case, in that case, they have brought this act. So first of all, any physician who's doing the diagnosis for pregnant women, they should not reveal the gender of the baby. It is more important. Second thing, if the baby is having any chromosomal abnormalities, they should not say that. What is chromosomal abnormalities is sometimes it is good to say to parents if it is in a serious cases. Sometimes what happens is the baby might would have undergone some serious illness like Down syndrome or blue baby syndrome or bubble baby syndrome. In that cases, you can always tell parents, and if it is an early stage, you can recommend them to abort. On other cases, you should not tell those things. Then sex linked diseases means sometimes the mother might have AIDS, or she might be having herpes zoster or some other disease like that. So it will be communicated to baby as well. So they will say like you need to abort the baby. In that cases, you should explain the parents in detail, but you should not reveal the reasons for that. Okay. Then if there is going to be any genetic disorders also, you should not tell those things. So what are the sex selection includes? What is sex selection includes? First is the procedure. So whatever procedure you do, you should not tell. Then what type of technique you use, that also you should not tell. So what is the difference between a procedure and a technique? Procedure is if someone is trying to, see what type of sex is this, or if someone is basically undergoing any sorts like basically an ultrasound, it is called as procedure. So what is technique is if someone is trying to get one particular gender baby. For example, there are since medical industry has become very much advanced, you can select what type of gender baby you want. It is basically they, if IVF centers are doing such things, so basically they should not, that is called as technique. If you're trying to get one particular gender, then that particular technique, it should not be included. And then third is test. What type of test you are using, like blood test, sugar test. So these are the normal tests that are being included. So these tests also should not be shared with anyone. Then administration. So if you are giving any drugs to the patient, okay, so they will give, like sometimes the blood count of the patient will be very less, so they will ask them to get more blood. They will give blood for them. Sometimes the baby will have malnutrition. In that cases, they will prescribe some drugs. They will install some drugs in the patient's body, in the mother. So administration is more important, and you should not share those things with the patient. Or actually patient has rights to know what type of treatment they are undergoing, but it is not like sharing like everything, each and everything they are doing. So because sometimes it might lead that patient to think like, oh, we no need this baby. They might think it might be a girl baby and they might abort it. So that's the reason they are not sharing those things. Then prescription, what type of tablets they are taking, or these things and all should not be revealed. Provision. Provision is nothing but sometimes what happens is they will be admitted in the hospital and they will be asked to stay in a bed rest for a long time. So at that period of time, at that duration, sometimes they it will be very hard for them to segregate baby in themselves. So in those cases what they will do, they will ask them to be under a bed rest. So they will give some analysis, they will do analysis with the patient, how to get pregnant, how to get help them to get pregnant. Those cases they will say I need only this, I need only that. In that particular cases, doctor should not reveal any of these things to the patient. The only thing doctor has to say is the baby is good, you're fine, you're perfectly fine. Only these things he or she should say. Other than that, they should not say what type of procedure, technique, test, or administration, or prescription, or provision that they are going to use on the patient. So, how to register a PNDT? First, why we have to register a PNDT is PNDT is not meant for a doctor. It is not meant for any particular physician, not like that. It is meant for a place where the ultrasound is going to be performed. That place, for that place, we are going to get a registration. So we need to register the place or center that the ultrasound is performed. So that is how it works. Okay, it is not for doctor, or it is not for the physician, it is not for sonologist or radiologist, or it is not for the machine or ultrasound machine. No, it is for the place that we do the ultrasound. So next one, there is no separate registration for each and every ultrasound machine you buy. See, if you are going to start a clinic or if you are going to start any center, you have to get PNDT for the entire center. But you can get as many as ultrasound machine you want for that center. But if suppose you are going to start a center with the same name in another area or in another place, it is important that you get a PNDT for another place, for another center. So there is no separate registration is required as long as if you get PNDT for one particular place. But if you're going to start in a separate divisions or in a separate places, you should get PNDT for each and every places. So next one is Form B. So what is Form B? Is it is the form that has been brought by Indian government that you should register that particular things. I have given a detailed explanation of forms in another sheet. I will explain you Form B over there so that you know what exactly Form B is. Then you should file an affidavit saying that this clinic or center will not conduct any test or procedure for sex determination. Basically, any physician who's doing an analysis of a fetal study, he or she must do only the general parameters. They should not do anything that is related to sex determination. They should undergo the fetal analysis should be purely based on the general parameters, that whether the baby is fine or not, and how and the goodness of the mother and the well-being. So basically these things has to be done, and they should file an affidavit for that. So these are the forms that you should know. So first one is Form A. So it is basically an application that is what to say for any registration form. Like I'm going to do a registration, like anything. It can be for anything, like a counseling center or laboratory or for anything. It is not like you're going to do only for the ultrasound center or for a clinic. It is basically application form for registration or for renewal process. Then Form B, certificate of registration. So what it is basically it is a certificate that has been provided by the Indian government or Tamil Nadu government, stating that this place has been registered. So anyone who's coming under doctor who's doing this has been a certified person, and you can come here and you can do ultrasound here. So it is basically a certificate of registration is called as Form B. Form says form of rejection of an applicant. That is, you would have filed a form, but the government would have cancelled that form. Okay, or if you would have filed a form for renewal process, so they would have rejected it. There might be various reasons for rejection. Sometimes, there won't be proper ventilation, there won't be any changing room. So, a person who's coming for inspection might think, okay, this place is not good for taking ultrasound. Or sometimes the person who's starting the center might would have undergone some cases previously. There might be some litigation going on, so on that cases they will reject the form. So the form D is nothing but the maintenance of records, and the this form D is not used in the field of ultrasound much, but it is important that every medical center to do maintenance of records. And form E is also not used here. Form F is used here. Form F is used because it is important that we have to maintain a record of each and every pregnant women that they come to clinic. It is mainly used in the field of IVF. Whenever they go for an IVF, they maintain these things. So the important thing about forms is everyone should know how to file form A, and how to get form B, and how to maintain form F. So these three forms are very important. So what happens, what and how we have to maintain a PNDT? That's what I have given here. So we should file another affidavit saying that signage or boards of no sex determination. That is, we should place a board in the clinic or center stating that we don't see. If you see wherever you go in India, there will be two boards. Okay, one board will be green in color and another board will be in blue in color. One will be in local language and another one blue will be in English. So this green board will say that we won't find any sex of the baby, and they would have explained everything below that what happens if we don't follow the PNDT Act. So you should always place the board, green board, blue board inside and green board outside, just for the understanding of the patient. And there should be always a copy of an act book. It should be there in all the scan centers and the clinics, where because it is important that Indian government act has been stated that without a act book, or without a copy of an act book, or these boards, their center will not be recognized as qualified center. And then name, qualification and experience certificate of the radiologist or sonologist should be attached along with the registration form, along with the form B. Okay, so it is also very important because they should know that the radiologist has been enrolled in the medical council, and they should know how much year of experience they have had in the field of radiology or sonology. So the fee details changes from state to state, but it is mandatory fee all over India is 25,000 that you have to pay for this to get a PNDT enrollment. Okay, and then the validity of the certification for PNDT is 5 years from the date of enrollment or date of installation. So whenever you install or whenever you install any ultrasound machine, from that date till 5 years you have 5 years. Before that, you won't have any expiration date. Once 5 years is over, you need to do the renewal procedure. So we have to do renewal procedure once again. That is, we have to get certificates again. Once again, we have to go to PNDT office, and we have to ask them to file once again for that. Form F has to be submitted in doctor's requisition to be preserved. That is, you have to state that like we are providing good care to patient. We are not sharing any of the patient's details to any of the outside person, and it is very important that we are maintaining the confidentiality to the patient. So, what are all the things that PNDT has to be maintained? First is case records. What type of, whichever case they are handling, it can be anything. It can be related to cardiology, gynecology, or radiology. So, you should maintain case records. Then, images. Whichever images you are handling, you should maintain those images. Then, medical prescription and drugs. Whatever medical prescription you are giving to the doctor, you are giving to the patients, you should enter that in the system, and it should be saved in a file. Then history of the patient, that is sometimes the patient would have took you know care from one hospital, and they would have transferred those files from one hospital to another hospital. It is important that while transferring, you should maintain the confidentiality. You should not share those things, and it is very important that you maintain the history at regular basis. Then these things has to be protected by the physician for at least 2 years. You should not erase any of these things like case records or images or medical prescription or history of the patient for at least 2 years. You should not erase them, because very often health inspectors used to come and do inspections. So when they ask or when they check the ultrasound machine, you should show them for the records of past 2 years. So if you fail to do that, it might lead to serious issues. So you should not erase things for at least 2 years. So what happens if we don't abide the PNDT? So when if you reveal if you reveal the gender of the baby, or if you are going to say anything that is related to the baby, or if you are going to say about something about the patient, and if something happens to that patient, for the first offense, they will give 3 years of imprisonment and 1 lakh rupees fine, and for subsequent offense there will be 5 years of imprisonment and a fine up to 5 lakhs. So the it won't stop there. Then the name will be removed from the medical council for the first offense, and it will be removed like for around 1 year or 2 years. If it was done at subsequent times or subsequent offense, then it will be removed permanently. This PNDT Act does not apply only for the physician; it is applied to the patient as well. If something wrong done by the patient, if they do abortion without the doctor's consent, then they will be given 3 months imprisonment and 1 lakh rupees fine. So next one is PACS. So what is PACS? Why PACS is important in this ultrasound techniques? PACS is nothing but picture archiving and communication system. So what is archiving? Archiving is nothing but it's like saving, or it is like downloading from one place to another. So whenever you should able to archive. Why we are using PACS is it helps to maintain the large amount of pictures, large amount of data. It is easy for one particular clinic to maintain. They can maintain images in their own setup. But if it comes to a multi-specialty hospital or big hospitals or centers, what happens is you will have images, lots of images from MRI, you will have images from CT, you will have images from ultrasound, X-rays. If it is not only for one MRI, if that hospital has two MRI or three MRI, so what happens is they cannot maintain that. The storage will be very difficult for them. In such cases, we can go for PACS. So what happens is it stores multi-modality images with the patient's database information along with the patient file. So there will be like number of doctors who will be working. If you go to an hospital, there, if you go to gynecology department itself, there will be around 20 to 25 gynecologists, and for them there will be around patients around, like for each gynecologist per day they will see around 20 to 25 patients every day. And there will be number of, you know, images taken for ultrasound, or for based on gynecology. They have to maintain those things. It is, if it is only for one center, it is very easy, but if you just think it is going to be like for these big hospitals, it is very hard to maintain that. So they will help in that cases. So it also helps to view the images in remote locations. What happens is sometimes in like, in villages and all, there will be like a primary center or a primary healthcare center. Small healthcare centers will be there, that has been started by the government. So what happens is they cannot go directly to the multi-specialty hospitals and all. So the doctors who are there, what they will do, they will take those images, and then they will try, if they want to get a second opinion on those images, they have some doubts on those images, then they will transmit these images to that particular hospital. So, and they will get their doubts cleared, and sometimes they will suggest this patient to go over there along with these images. They will say, we have sent those images there, you can go and ask them. They will help them out. And it is also widely used for education purpose also. So it can accept any image that is in DICOM format. So next important thing that we are going to see is DICOM. So how PACS is used in DICOM. So I mean, how DICOM is used in PACS, we can able to see that. So this is how a PACS works. So they will get multiple images from each and every thing, and they will store in one particular place. Like, can you see here? They are getting images from one system. They are getting images from an MRI and CT. They are getting images from an ultrasound, everything. So it is important that we store these images. So what is DICOM? DICOM is a digital imaging and communication in medicine. So we see generally we use this DICOM to avoid paperwork. Okay, because each and every time whenever you take scans and all, previous days, even nowadays, they used to file like a it will be like a big book. They have to give a scan report like that. It will be like huge thing. Nowadays they are asking for CD drive. You can able to save it in a pen drive, everything. So basically we are doing a digital imaging. So that is called as DICOM, digital imaging and communications in medicine. So it is a non-image data, like scanned documents incorporated. So whenever other than imaging data, for example, nowadays prescriptions are not written by doctor in hand. They have a software setup. They will send the prescription directly to the pharmacy, and they will give you all the drugs whichever necessary. So these things also encapsulated by the DICOM. So what are the components that is required for DICOM? First thing is imaging modalities. It can be anything like X-ray, CT, MRI, ultrasound. It can be used as anything. So imaging modality plays a major role here. Then secure network for the transmission of the patient information. See that whenever you find a network, you should be always be careful that we maintain a confidentiality. And whenever we do a transmission of patient information, it should they should maintain some uh, records at regular basis. So it should be a secure network that nobody hacks it. So we should be very careful with that. then workstations for interpreting and reviewing the image. So why there should be a workstations is generally where they will keep workstations is basically on the remote areas, and if there is going to be a medical camps, if they are going to do any setup on medical camps on those areas, they will send these ultrasound machines or some sort of medical imaging machines over there. So they will interpret these data and they will send it to the hospital and they will review these images. In that cases, workstations has to be maintained. So, and then archives for the storage and retrieval of images and reports. So you should maintain proper archive technology. If there is going to be issue with that, it causes serious problems. So whenever you're trying to store an image, you should be able to retrieve that image. It should not be like get deleted once if the capacity goes off. So you should set up a DICOM like that. It should be you should be very careful with that. So first thing you should know how to get the imaging modalities correctly. There should be a secured network, and then you should maintain a proper workstation, and then you should know how to archive the image and archive the image, that is to store and retrieve the image at regular basis. So this is the DICOM image. So you will get the data from one end, and you will get the data, you will be transporting the data from one end to another end securely. So that's how it works. So this is the procedure of PACS. First you will get the images of an ultrasound, then the images of an ultrasound is digitalized, then it is transmitted by DICOM, then it reaches the end user. So, what is the uses of PACS? Why PACS is very much useful? That is, these are the four important things that, as far as I have seen, when we have used PACS. One is telemedicine. Telemedicine plays a major role nowadays. Telemedicine is not only used in abroad. Nowadays it has been used in almost all developing countries like Africa, India, Iraq, Iran, Pakistan. In almost all countries, everyone are using telemedicine, especially in remote areas, especially in villages, in primary healthcare centers. So telemedicine plays a major role here. And next, I hope everyone knows what telemedicine is. And even in America, they have brought a special insurance policies that covers telemedicine, especially for the people who are under the age of 80, people who are under the age 80 and above 80, because it's very hard for them to go to hospital directly and get diagnosed or get treatment. In that cases, telemedicine is very helpful for them. And then it replaces the hard copy storage. In those days they have to store like a large amount of paperworks, they have to do lots of paperworks. So it obviously it replaces the hard copy storage. It helps in distance education, especially the doctors who are in the final years, doctors who are under the like house surgeons and all. They'll be working in primary healthcare center in government hospitals. Some doctors will be working in the uh, medical camps and all. They will so for them it will be very helpful. It helps in distance educations. And then radiology workflow management. See, basically, as I said before, radiology is a huge department, like x-ray, CT, MRI, ultrasound. Apart from these four, there are like PET, and then there is if there is called as proton therapy. So whenever if these things and all, if there is going to be taken places, it is very hard for them to maintain a huge amount of image files and image data. So it will maintain radiology workflow management very well if we use PACS. So whenever there is an advantage, obviously there will be a disadvantage. So what happens? What are all the disadvantages in packs? First thing, it is a very expensive project. So whenever you are going to have packs, you should be ready to spend money to get a quality workflow. Second one is staff needs an additional training on packs. See, each and every nursing staff, each and every radiographers, each and every doctors, they won't know what PACS is exactly. We have to train them based on that. We have to give training on each and everything. So staffs need an additional training on PACS. And there is no guarantee for archive image. So if the image is lost, that's it, you cannot retrieve the image. So it is important. So as I said before, you should maintain the archive technology properly. If you fail to do that, then it's waste of doing installation of packs. Then a computer engineer is required on daily basis in need of fault. So obviously there will be a fault, because since we are maintaining a large amount of details, large amount of database, it is important that we have to have a tech support along with us. If there is no proper tech support, we tend to lose lots of information at regular basis. And then confidentiality will be a problem here. Of course, why it is? Because since we are transmitting images from one place to another, it is quite hard for the persons to maintain those confidentiality. But yet we are doing that in a very good manner. So these are few disadvantages of the packs. So what is okay? So before going to next slide, why I have included that slide is many doctors even asked me how to place a proper probe, how to maintain, how to get a good image in an ultrasound. So my suggestion is to get a good image in ultrasound is to place the probes correctly at correct position, and how to place a probe to view which part you want to view. See, for example, if you're going to view an abdomen, okay, there is a technique how to view an abdomen. There is a technique how to view a fetus. So you should know how to, you should learn those scanning techniques in the med school itself. It is not a duty of an application specialist to teach you how to do scan procedures. We can teach you the features. We can able to teach you how to enhance an image, how to get a better image. But we can't able to teach you how to do a scan procedure. You should learn that. I mean, any physician, they should themselves take interest and learn those things from the med school itself. So, what is a transversal and sagittal plane? So, transversal is viewed for the anterior region of the body part. So, anterior region is the front position or the front body part. So, basically, they should know what is a transversal and what is a posterior side. So, anterior side, why we are going to see an anterior part? In which cases we will see the anterior part is, basically, we will see the anterior part on almost all images. For example, we will see in heart. So whenever you see on heart, we will see, like, the anterior position. Basically, we have to see the valves. If we want to see the valves, we have to look only the anterior position. Then if we want to see the position of the aorta, or if we want to see the position of superior vena cava or inferior vena cava, we can only see on the transversal view. So the transversal view is viewed from the right to left of the image. That is, uh, Athena sir, could you please switch on the video so that I can able to show them how to, place the probe to view the transversal.
Yeah, I switch it on your video. You can able to proceed, sir. Now.
Yes. So if you see, like, this is the abdomen. Consider this is the abdomen, and you want to see the consider this is the abdomen, okay? And now my kidney is here. This is where my kidney is located, okay? So now I'm going to view my kidney, okay? And now how I can able to view my kidney is I have to place the probe like this. Okay, if I place the probe like this, then only I can able to see the transversal view. If you place the probe like this, like in this kidney format, you won't see anything. The image will be very blur. So you have to place the probe like this. This is the exact angle. Have to keep it like this and view the kidney. Okay. Then, so this is the heart, right? My heart is present here in between here. So how I can able to see the heart is this area have to place like this. If you place like this, you have to press it here. Have to press it here and view the image. So I hope everyone saw how I explained that. So let me go to the slides. So okay. So this is how. So as I said, like, this the first position that I've shown you, that is a transversal view. The sagittal view is instead of placing from right to left, you have to place it from top to bottom. Basically, we will see the sagittal part mostly on the like fetal analysis, or basically from you will do it on while taking head circumference and all in the fetus. At that time you have to do sagittal view. So I hope you people will have how to do analysis on transversal and sagittal process. So how a sonography room should be, how you should get a sonography room is, it should be, it should maintain some ambient light control. Ambient light control is like, the room should be first of all air conditioned, and basically most of the time whenever you go to any radiology room, it will be dark, and except the console. And it's because to view the better image, to get the very good image, for that reason. And so that's the reason they are asking the room to be in an ambient light control. It is not like light should not be there. Light can be there, but it should be in a mild position. Okay. Then there should be an examination or trolley or a bed. It should be maintained properly. There should be a changing room, and then there should be a washroom. So these four things should be there in all sonography room. The person who's coming, like if any health inspector or any person who's coming for an inspection, they will check all these things. And there are like few square meters that has to be maintained for all these things, like for changing room, then the for place that kept for an ultrasound machine. For that there will be some square meters or square sense that has to be maintained for washroom, everything. So these things and all will be included in the PNDT form itself. So you have to maintain those things. And apart from these things, I'll be telling you the software and the ultrasound. Okay. uh, you guys were asking me about what are the softwares that is used in ultrasound. So basically there are two softwares. One is Linux based software and Windows based, sorry, Linux based ultrasound, Windows based ultrasound. So what is Linux based ultrasound? Is mostly Linux based ultrasound are nowadays it's not available. It has been outdated. Nowadays we have only Windows based ultrasound. So, but yet it is my duty to tell what is Linux based ultrasound. Linux based ultrasound, before when the ultrasound was bought into the field of imaging, we had only one software, that is Linux. So in that what happened is, we can able to store images in Linux, but it was not comfortable like Windows. It was not very user friendly. Linux based ultrasound has only one thing, that is only two modes, that is A mode and B mode. You don't have any other mode in Linux based ultrasound. You won't have color mode, you won't have Doppler mode, you won't have motion mode, or you won't have any Doppler shifting. You won't have any features at all, and you cannot use any probes other than convex or TV or linear. You can use only these three probes, or I mean four probes. You can use only convex, TV, linear, and cardiac. And another major disadvantage in Linux based is the port, that is, see, if you take any Windows based machine, at least there will be like three ports available. But if you take any Linux based machine, you will have only one port or two port. So what is port is, the probe that we place. Okay, the probe that we place in the ultrasound, right? Below there will be a small port. In that we have to fix the probe, and then only we can able to scan it. So like, there will be like two or three ports or four ports in the Windows based ultrasound machines. But if you go to Linux based, it will you will have only one or two ports. And if you take portable machine, you will be having only one port. So it will be very uncomfortable for the doctors to use. For each and every time they have to change, they have to take one probe. For example, if the gynecologist is going to use a machine, she has to change the probe each and every time whenever she's changing the modes and all. So it is quite difficult in Linux based machine. Some of the Linux based machine are like DP50, DP1600, then M70. There are few machines are like that, Linux based machines. And then Windows based machines, almost all machines are Windows based machines, like Clearview 350, Voluson, Logic, and then Epic, then DC60. Almost all machines are Windows based machines. The major advantage in Windows based is it is very user friendly. Doctors can able to do DICOM, their DICOM packs, everything they can able to install in Windows based. In Linux based is quite difficult for them to do that. And it is very easy for them to store data. And in Windows based there is one more advantages. They can use as many ports they want. There will be at least four ports in almost all machines. And if not, there will be at least three ports for each and every machine. Without three ports, there won't be any machines in Windows based. Almost all machines will have three ports. And you can able to see that. And what else we can tell about Windows based is, um, if there's going to be an installation, or if there is going to be any issues in Windows based, you can easily retrieve the image in Windows based. But in Linux based it's quite difficult. So these are the softwares that is used in ultrasound. So hardware functions. So what is hardware? Hardware is nothing but boards that has been used in ultrasound. See, boards varies from each and every machine, because the function and features of every machine are quite different from each other. So what happens is, the boards that we are using in ultrasound, it varies according to that. So These are the boards that we are using in ultrasound. These are common boards. Okay. The first one is motherboard. Motherboard is, everyone knows what motherboard is. DC board. What is DC board is? See, ultrasound is a DC machine. Okay, so you are connecting to an another DC connection. Okay, so it is basically from a DC current to DC current. So that transmission is called as DC board. Then inlet outlet fan. What is inlet outlet fan is, the, as I said before, it's like it's like an it is as it's used in an air conditioner and all, right? So it's basically like that only, an inlet outlet fan. Then an engine board. Then there is a transmitter and receiver board. So what is a transmitter and receiver board is, so you will get a image, I mean basically uh, you will the transducer will pick up an image from the body. It get processed, and then the image will come back in the monitor, right? So for that process, for that entire these things happens in seconds. Basically, whenever you keep the probe, you can able to see the entire image inside the abdomen, or in the, you can able to see the heart, everything. It happens in seconds. It's just because of the transmitter and receiver board. So what is this probe connecting board 1 and board 2 is, I said a port, right? I said a term called port. This port is connected directly to this hardware functions. So whenever you have to fix a probe in these things, and it will be connected towards the motherboard, and with that help you can able to see the entire image. So there are few other boards that are included in this, like there is a continuous wave board, there is a 4D board. So basically 4D board, continuous wave board will come into the function only if there is going to be an echo process. If there is no echo process, that machine won't have a continuous wave board at all. You no need to fix that board at all. It is basically a service engineer who installs the machine. He himself will come and fix the fix those things according to the provider. Basically whatever the physician needs, he will come and fix those things. Then 4D board. 4D board, as I said yesterday itself, if there is going to be a 4D option, if there is going to be anything that is related to 4D, if the person needs the 4D images, then 4D board comes into an existence. But again, you might ask me, see, you're telling there are machines like around 70,000, 80,000. So in those and all 4D boards, you can be able to install only if the provider wants. No, it's not like that. It will be there inside the each and every machine. 4D board will be there after some cost. Okay, it is the doctor who use it. If he wants that probe, or if he is going to use that probe, he can use it. If he doesn't want, if he is not going to use it, it's not a necessary or compulsion that 4D board has to be used. Apart from that, there is one other board called DC-AC board. See, if the machine is going to be connected from DC current to an AC current, it is important that we check the earth process, and we should check the main everything, and the current flow everything, because sometimes whenever there is the DC AC current mix up, the machine tend to fall under short circuit. So we should check those things. And basically how these boards has to be maintained, how hardware functions has to be maintained is, we should call the service engineer, and ask them to check whether they themselves will do. They will open the circuit, and they will dust all these boards, and then they will check They will check with the multimeter whether they have all the connections are given correctly, whether the current flow is correct. They will check the earth, they will check the main, they will check neutral, then they will check whether they will clean the inlet outlet fan. They will check for the port. If there might be some issues with the port, what happens is the doctor has to press the port properly. See, it is okay with the Philips products. We don't have a port, you no need to sit down and lock the port and all. You can just fix like a normal button and you can go. But when it comes to like my like machines, like other I'm not here to talk about other products, but you should know what issues doctors are facing on probes. So they have to sit and lock the probe properly. If they fail to lock the probe properly, the pins in the probe, right, it will get damaged, it will be broken. So what happens, they have to call again the service engineer, and they have to change the pin, or they have to change the board, or they have to change the probe. First of all, the doctor himself will not know that the pin has been broken. So they should be taught how to use the probe correctly and how to fix that in a port. And whenever you place the probe in the probe stand, you should place it properly. So you should take more care about that. And in transmitter receiver board, what happens is sometimes whenever there is a short circuit, it will attack directly from once the short circuit has happened, it will attack directly the monitor because of the transmitter receiver board. Once it gets affected, the picture will not be shown. People will think that, oh, there is an issue with the monitor. No, actually there is an issue with the hardware. So you should know what how these things works. And apart from these things, what other boards are available is input output board, analog, and arithmetic and logic unit board. So what is input output board? Is input output board basically you're switching on the system, right? So whenever you switch on the system, the input output board, it helps you to switch on and switch off the system. And what is analog and arithmetic and logic unit board will do is it helps you to do a logic process. Sometimes the calculations that has been used. See, as I said before, we use a feature called I think you people remember a smart NT, smart OB and all. So for smart OB and all, you have to calculate the biparietal diameter distance, and then for smart NT you have to calculate the nuchal transculency and all. So doctor has to calculate these things manually. So what happens is he has to trace the entire skull from top to bottom, and he has to do those calculations manually before and all. But nowadays we have a button for that. So how this thing work, it's because of the ALU. Without ALU board we can't do anything. So basically it is like all boards are like all the hardware functions are basically like a normal computer. Okay, normal PC, personal computer or laptop. So in this cases, it is everything the same. The extra boards we had, apart from the computer, the other boards and all, we are adding according to the ultrasound machine's functions. Okay, basically ultrasound machine is like a PC only. It's like a computer only. The only thing is we are using it for imaging purposes. We are using it to find the we are using it for the study purposes and for the imaging and diagnosis purposes. Then we have a memory board. What is the function of memory board is it plays a major role along with the DICOM and PACs. So whenever it's basically it helps to store a RAM, ROM and all. So read only memory and then random access memory and all. So basically it helps with those things and all. So these are the basic hardware functions that you can able to see. And so there are some advanced techniques in you might ask, so how hardware functions helps in how software and hardware functions helps in portable machines. Like, we have a machine called InnoSight, and there are few other machines, portable machines are available. So whenever it comes to portable machines, the hardware functions are quite same, but there will be a slight modification. Now you take uh, you know basically it will be like an iPad. Consider a machine like iPad, or basically other machines and all. It will be like portable only. It will be very small machines like a laptop. So in that cases, the hardware will be fixed below the machine, and software setup and all remaining things are all going to be the same, but it will be in a miniaturized size. Hardware will be in a miniaturized size, and the software functions are going to be the same. But again, there will be few alterations in the hardware and software when it comes to portable. And yes, and one more thing, in portable machine, the ports, basically the ports will be in the sides of the ultrasound. Okay, it will not be below and all. It will be in the sides of the ultrasound, and the probe stand will be in the. Consider the probe port will be in the. For me, it is on left side. Okay, for me on it is left side. The probe port is on the left side, and the probe stand is on the right side. Okay, so basically what happens is, you have to again place the probe correctly on the port. If you fail to place the port, lock the port, I mean probe properly, you tend to lose the pin, or you might damage the port. And what happens if the probe's port gets damaged is, first thing it attacks is the image quality. You won't get the proper image. And secondly, the waves, the whenever you take a wave, whenever you give a pulse wave, or whenever you give a continuous wave mode, if you press the pulse wave button, you won't get the proper sound. If you press the continuous wave button, you won't get the proper sound. It will give a sound like shh, like that sounds and all will come. So what happens at that time is, the you won't get the correct information from the machine. So you should place that correctly. So these are the software and hardware techniques that we are using here. So I think I have completed software, hardware, everything, and I have told almost everything what I have left. Okay. Yes, I have completed everything regarding these things. So is there any doubts? So let's move on with the session. No, interactive session. If you have any doubts or issues with the system. Hello.
Hello.
Yes, ma'am.
Hello, sir. This is Priyanka.
Yes, ma'am. How may I help you?
Sir, as you talked about that PAX, no?
Yes.
Is there any other software is there instead of PAX, or only one source is there?
PAX is not meant to be like one particular software. There are many softwares. Okay, we don't know. It depends upon the companies that they are using. PAX is not like it can be used by one particular software and all. It is based upon like an economy. For example, depends upon the doctor and depends upon the setup that they are going to use. If it is going to be for a multi-specialty hospital, the cost of packs will be much higher than the normal clinic. Generally in clinics they won't go for packs at all. Packs, they will just go only for DICOM to save the images. PACS is used when there is going to be like, multi-modality things, like, like too many images has to be stored, or if there is going to be like too many data has to be retrieved. At that cases only they will go for PACS. And there is no particular software that we have to use for the PACS and all, because it is more related to computer science. uh, Basically they will use software that supports windows based, because almost all the equipments are windows based, right? Any
Okay.
imaging technology you take, it is basically based on windows based. Any software that supports windows based, they will go for that.
Okay. Is there any distance limit is there for the packs?
Yes, of course. Distance limit for packs, it depends upon the quality of software that we are using. Okay. Sometimes if we are going to do the in a workstation is going to be in a remote setup, like in an for like very far places and all, and if it is going to be like a medical camp and all, um, there are some restrictions, maybe like around 450 kilometers, or like 420 kilometers. In that,
Okay.
that it depends upon the packs or software that we purchase. They will explain about that.
Okay. Okay, sir. Sir, and one more question also I'm having. Yesterday you
Yes.
talked about that MedTouch software, no, for image
Yes.
transfer purpose.
Yes.
After that, Pandian sir shared one screen also. Like same,
Yes.
one probe is connected to mobile. It's
Yes.
handle Doppler or it's some other thing.
You're asking whether that image is a Doppler image?
No, no, no. I'm not asking about that.
Uh-huh.
He shared one picture. In that picture, they connected one transducer to the mobile phone, right?
Okay.
It's a hand because yesterday you said it's a method software, like you said, no?
Yes. So you're asking whether that software is a method software?
No, whether it's technology is palm. Because I heard one thing. Handle Doppler. One Doppler is there, no? They in handle Doppler means they will connect the transducer to mobile phone.
So basically, you're asking is MedTouch is handle
Ah.
Doppler?
Yes, MedTouch means we will transfer the image from ultrasound to mobile phone.
Android.
Right?
Yes.
Android. Yes.
Yes.
Handle Doppler means we will connect the transducer to mobile phone. Right?
So yes. So what I can say is MedTouch is like, what to say. They are naming software in different name. Okay. So the
Yes.
features that I have given you yesterday, it is not going to be the same name in other companies. If you go to GE, if you go to Mindray, or if you go to Philips, they say it is not it the name of the feature will not be the same name. It will be in a different name, like as you said before, like handle Doppler.
Yes.
Yes, I think it's same, but I will not accept it is the same like MedTouch,
No,
because
handle Doppler is not a software. No, it's one kind of ultrasound machine. What? Or
you're telling me handle Doppler is like an
now,
ultrasound machine?
sir shared me one picture. No, in screen.
Yes, I can see that.
What is that thing, sir? Actually.
You're asking me what image is that? I mean, what
No. Yes, what
exactly
thing
is
is
that?
there? It's handle Doppler or they are showing the MedTouch transfer picture.
It is not MedTouch.
It's a handle Doppler.
Yes.
We will connect
Because
transmitter to mobile.
yes, why I'm telling it is not MedTouch is MedTouch. You can it is not needed that you have to connect the probe directly to the phone, because we can connect it through Wi-Fi, or we can connect it through the what to say, like a LAN or any of those things.
Actually,
Okay.
MedTouch is a software which was installed by phone. So your ultrasound act as a Wi-Fi transmitter and Android act as a Wi-Fi receiver.
Yes.
So from ultrasound we will transfer image to mobile phone. Also
Yes.
in that MedTouch software, one guide also there, no sir. It will show how to scan and how to place the probe. That thing also MedTouch will show, no?
For that, we have another feature called, we have another feature, iScan helper. So iScan helper will do that. In MedTouch, it will just help you to retrieve the image and show the image, because we can't extend the probe from one place to another. Right. For example, if you're going to do a scan on a leg, okay, and
Okay.
you at that period of time, you have to scan from, consider you're going to scan a femur. Okay,
Okay.
so you have to scan the entire femur part. Okay, so what
Mhm.
happens there is, it is very hard for you to scan the entire femur part because it is the longest bone. Okay, so
Yes.
in that cases, you can't see an extensive image, right?
Yes.
So even if you use linear probe, you can't able to see an extensive image, but you can able to use a mobile phone to drag an image and see. I mean, you can able to move the phone from one area to another area. Correct?
Yes.
You can able to see the image in the ultrasound machine as an extensive image, right? But
Yes.
if you are going to see through the probe, you can see the image, but you have to see it as a part by part, but it's quite difficult for the doctor to diagnose it. So that's the reason they have bought MedTouch.
Okay. Okay. So while doctor scanning for example, they are scanning the lower limb. That time they can't able to come to machine and adjust the thing. So they are using mobile phone to adjust those parameters, right?
Yes, that's correct. Actually, yes.
Yes. Thank you, sir.
You're welcome. Is there any other question that I can assist you with?
Hello, sir.
Yes, Fawaz. Did I
Yes.
answer your questions? I was
Yeah,
looking
yeah.
for.
Most of the basic things I got it. I got it. Because I think you have gone through this position of how they have get the probe is positioning and all these things. Okay,
No,
ma'am. The next thing is
actually, what I was trying to convey is basically it is important that a doctor has to learn how to do scan procedures. It is not
okay.
a duty of an application specialist or a medical engineer to teach them. Okay, so
Yeah.
if we can able to teach the features of the machine, we
Okay. Okay.
cannot
Fine.
tell
Fine.
them how to place a probe, right? They have to know
Okay.
what is a transverse view, what is a sagittal view, and how to view those things.
Yeah. Okay. Fine. Fine. Then, ma'am, I have another question. It is basically on the the clarity of the machines. You know, if any
Your
EMI,
voice is very
electromagnetic.
low, Fawaz. I couldn't able to
Yeah,
hear you clearly.
now, now, okay.
Yes, now much better. Yes. So, tell me, Fawaz.
Yeah, sir. I had seen in most of the ultrasound machine. I had seen so many people is guessing only some things. I will tell you the example. For example, the grounding EMI. Now the world is surrounded with most of EMI. Electromagnetic interference is occurring.
Mm-hmm.
Most of the noises are coming from so many machines. So even the grounding also, when you take the grounding,
Mm-hmm.
it will all affect most of the machines functioning. Okay,
Mm-hmm.
how can we, piezoelectric effect? That is the proper function. That is the functioning of that crystal vibration. Is we call it as piezoelectric effect. So you know, uh, it is an array of crystals actually. Every probes are arrays of
Y-
crystals. So
yes.
if any one crystal is getting damaged, I'm telling the example, okay?
Mm-hmm.
If any one crystal is damaged,
Mm-hmm.
how can we categorize that whether it is the problem with the grounding or whether it is the problem it is occurring from the any EMI or whether it is the problem with the that is the problem? How can we correctly knows about that? How can we categorize actually? So whether this is the problem, actual problem, how can we categorize? Can you just tell me about that one? Because most of the people are guessing only. Even the company engineers, I had seen that if we ask what is the problem, then he will tell that sometimes maybe they will use it like that only. So is there any particular?
Okay,
way
but
you
I
can.
don't know exactly how that system works. But when I worked, okay, I'll just
Yeah,
share my experience with you, Fawaz. Okay, so
yeah,
what happened is basically it is a duty of a service engineer to look upon all those things like grounding procedures, earth, neutral. Whenever he's trying to fix and or doing an installation, he or she has to look up on all those things. And you asked me if there is going to be an issue with the piezoelectric crystal, how to categorize things with the EMI. Basically, whenever there is an issue with the crystal, there is nothing to do with crystal or EMI. It is totally an entire topic.
no, no, no,
Okay.
no, ma'am. No, no, sir. The thing is that it is what I am. My doubt is that if it is a one crystal, no problem, you can identify because it is an array of crystals. A very thin array of crystals are in the ultrasound probe. Sometimes this grounding and all other things sometimes may cause some uh, what we call white line. Sometimes we cannot even identify whether it is a problem with this one or whether it's a problem with that one. So that is my basic question: that whether how we can we
You
identify
want to
whether
know what happens if the piezoelectric crystal array of piezoelectric crystal affects,
one
okay,
if one
damaged.
if one crystal, from the array, one needs affected. If one is affected, sometimes you told that some pins, because one piezoelectric anyway, two connections may be there for one electric piezoelectric crystal. So this array of crystals. So due to that only, for the that much pins are coming out from the ultrasound probe.
Mhm.
So how if one is affected? I'm telling about the one condition, not the all crystals. If one is affecting, how can we categorize? Because sometimes same problem may be there, same thing may be displayed in the screen.
You
Sometimes maybe
cannot
it is.
categorize flowers because the problem is it is an array of crystal. Okay, you
Yeah.
cannot know if there is only one crystal gets affected. Okay, and
Okay.
basically
Okay.
you cannot depict a picture. Basic, you will get a picture even if one
Okay.
crystal affects or two crystal affects, or even if you get array of crystals get affected, you will
Okay.
get a picture.
Okay.
When you won't get a picture, when you know that there is a problem with this probe or with this you know with piezoelectric crystal is
Yeah.
the first thing
Okay.
is the it will get heating, the heat will be very high in the probe. Second thing, because of generating a lots of pressure towards the probe. Okay, so the heat will be very high. Second thing, what happens is because of that heat, the rubber, the layer above the in the probe, it starts coming out. So that is the second issue. So with that only you can able to find that okay, there has been an issue with this system or issue with the probe. And there is no particular categorization for this piezoelectric crystal. And you need to know one more thing, since medical system has been very much become as advanced, they are not using like as I said yesterday, they are not using like array of crystal, they are using like active array technology. What is active array technology is they will be using only one piezoelectric crystal for entire probe. Okay, they will not sit and use some each and every piezoelectric crystal, they will not arrange like that. They are using one piezoelectric crystal for entire probe because it is more efficient, cost efficiency, and it is very much useful for scanning procedures. Fawaz, are you there? Hello.
Yeah. Yeah. Yeah, sir. I got it. I got it. I got your
Okay,
answer.
you got me. Did you have any other doubts on
No, no,
this?
nothing. No, no, nothing. Thank.
You're welcome. Is there any other doubts that I
Hello.
can
I,
yes. Yes, sir. I forgot your name. What's your name actually? Rajesh sir, I think.
Good evening, sir. This is Rajesh.
Yes, sir.
Sir,
So,
you have said previously there is any other. I'm Rajesh. Yeah, yeah. Okay. There is a PAX. No, there is PAX. PAX. Is there any course to do the procedure to PAX or any other education like anyone can do or engineers only they can do?
no,
PAX
there are
overall can
separate
do the
service
PAX
engineers who are
procedure
available for doing PACS installation.
or any training needed.
Yeah, that's what I'm telling. There are separate engineers who are
Okay.
available to do PACS
Any how long
installation.
duration of course or it's like a 1 year course or is added with the.
To do PACS, to do installation on PACS. You're asking, is there
Oh,
any
fine,
course
fine,
to do
fine. Okay.
installation on PACS?
Because I have a own packs person.
Mm-hmm.
Yeah, to do packs. Yeah.
I
Ah,
don't
yes. But because
actually,
he studied
I
only the
have no
BSc
idea
computer
about
science,
that,
I think
Rajesh
so.
sir, because
He's doing a packs because of his
Mhm,
working in hospital in India, more than people.
mhm,
Only training enough to do the packs.
mhm.
Ah, yeah.
But
Sorry for the interruption. You can continue, sir.
actually, I have no idea about, is there any training session or, is there any separate person who can do packs and all. But as far as my concern, when I have worked, I know that there are separate engineers who are available to do packs installation and do services on packs. Basically, it will be done by computer engineers. But for DICOM setup, it will be done by the service engineers from any of the company like Mindray, Philips, or GE. The DICOM setup they themselves will do.
Yes.
But for PACS as concern, I don't know.
Mm,
Is there any other? I have seen like other computer engineers doing for PACS. For my concern.
yeah. Okay, sir. I have one more
Uh,
doubt actually. Every individual ultrasound is having some internal memory, right?
mhm.
No need to back up, like, for example, for sharing the image one system to another systems, like a mix. PACS is organizing all the image together, right? Like, if I want to share one image to that, I can get the image, right? But we have
Yes.
individual internal storage, right? Why can't we use that? We can use it for internal purpose. How long the capacity of for each machine? You got my point, I think.
You're asking the internal storage of uh,
Yes, sir.
sharing for each machine.
Yeah. What is the capacity of the internal storage? I want to know.
It's
That.
like a normal
That's it, sir.
PC, basically like a random
Yeah.
access memory or read-only memory. How
Yeah.
much the normal
Yes.
PC has, the same thing. The only thing is it depends upon each setup that we'll do. As much as the cost of the machine rises, the
Mm.
storage capacity of the machine also rises.
Yeah, because I have faced one breakdown call.
Mhm,
What happened means that time the whole machine is getting hanging.
mhm.
Why? Because of the whole many of the files and images are storage. So the individual said, the engineer said, please delete all, backup all the images. Then only the machine work normal. That is the I have faced
So
that
they
cause
don't have a
problems.
DICOM setup
So
for
every time I
that?
need to backup all, or I needing, so I don't know DICOM setup. That's why the issue.
Yeah,
That's why I'm
I can
asking. Yeah.
understand that. Uh,
Yeah.
uh-huh. No, I'm
Yes.
asking you, is you don't have a DICOM setup for that?
I really don't know actually. I think maybe there are, I don't know. But
No,
I have a
actually,
small
whenever
issue.
they do an installation, they will be telling you like we are going to do a DICOM setup, because whenever you buy a machine, you're paying for
Mm.
DICOM. Also, you're paying along with the DICOM
Oh,
only.
fine. Fine.
And
Okay.
moreover,
But why Indian engineer said to delete the files? I don't
maybe
know. Maybe it's a big
yeah, that's
hospital,
what I'm trying
maybe.
to tell. You might not have a DICOM
Yeah.
setup, and it's very common that you can delete files for within 2 years, right? You can save the files for 2 years. So after 2 years, you can delete it automatically. It's not necessary that you have to save the patient file for
Yeah.
more than 2 years.
Later we can do. Yeah. Yes. Yes. Yeah.
Yes.
Yes. Yes. Yes. Yes. Okay. Thank you.
Is there any other question that I can help you with?
Mr. Avinash, do you have any clarification or you want to share anything?
Yeah, hello, Gautam.
Yeah,
Yeah,
tell me, sir.
yeah,
How may I help you?
yeah. For everybody clarification, you are mean to say the transmitter receiver now. So basically, probe also do the transmitting receiving function, right? So what is the
Yes.
difference between probe and the transmitter receiver board? Is just for
Yes.
everybody clarification, you can clarify on it. I think so. Hmm?
Yes, I can able to do that. See, what is the difference between transducer and transmitter receiver board is, see, transducer is the one which gives the signals. Okay, so basically these piezoelectric crystals, they throw the sound waves into the body. So it acts like a it's just like what to say, these sound waves go hits the body, and then it travels through the transmitter receiver board. Again it comes back to the transducer, and then it gets reflected on the monitor. So what is the difference between the transducer and transmitter receiver board is, this is the main source. Transducer is the main source. Without transducer, without the probe, you cannot able to generate an image. But the transmitter receiver board, it is just like a mode. It is like it is like a communicator, or it is like what to say exactly, what word I can put there is, it's like a medium. It acts like a medium between the monitor and the transducer. It helps to picturize the image in the monitor. uh, Do you got it, or you want me to explain in detail?
Got it, got it. Thank you. Hope everybody understand, right?
I hope they understood. Is there
Dear,
anything else that I can help you with, sir?
yeah, dear participants, do you have any clarification? If else, if you are not supposed to ask, you can able to put me in the chat box. Also, we can able to get the questions. Yeah, yeah. I think no more questions. I think so.
Okay, then. Well, if you have any questions, you can always reach to Pandian, sir. He's very good, expert in medical industry. I mean, he's very good expertise in teaching, and whenever you have doubts on anatomy or related to physiology, you can always ask him. So is there any default setting for ultrasound, sir? No, there is no particular default setting and all. Every ultrasound has a setting that we have generally for all ultrasound. Every ultrasound has to have a monitor. It should have a probe. it should have all the boards inside that, then only an ultrasound can work. Other than that, there is no particular default setting and all. These are the default settings during installation for particular doctors. Yes, it depends. Like if it is going to be for a gynecologist, I would say for her convex and TV probe is more than enough. For cardiologist, only matrix probe, sometimes along with ECG leads. And for if you are going to take for radiologist, he might need all the 4 probes, including 4D probe and ET probe also. Yeah, I forgot to tell about the function of ET probe. I'm so sorry about that. So basically, why we need to know about ET probe is ET is an endotracheal probe. So what happens in this probe is we use this ET probe for doing. I know like many of people, you people will be aware of endoscopy, right? So basically, this ET probe you can able to do endoscopy in ultrasound itself. So for that reason, you can able to use ET probe. ET probe is not widely used, but you can always use ET probe for doing endoscopy as well. And again, as Niveta ma'am asked, during installation, I have to know the difference between Niveta ma'am, during installation. Um, it depends if the doctor asks, and again, money plays a major role here. If the doctor wants only 2 probes, 2 probe is more than fine. If the doctor wants more probes, you can give more probe setup. Depends upon the doctor's user friendly needs. Sir, I have to know the difference between the role of medical electronics engineer and a biomedical engineer in an hospital. So medical electronics engineer and biomedical engineer both are same. There is no big difference between a medical electronics or biomedical engineer. Medical electronics is basically a post graduation for biomedical. That's all. So both are same. If you know there is nothing difference between both of them. Maybe the designation may be different. I think they will give more importance to a medical electronics engineer if they have that degree, I think. Especially in hospitals. So is there any other question that I can help you with? Okay, so I think like I have answered all your questions, and can always reach to me regarding ultrasound. I will be happy to assist you guys. And Adina sir, is a very good expert. You can always reach to him as well. And I know like many people are, I should learn from you people. You are also experts in various fields. I might not know about that, and if I don't know, I tried my very best to satisfy all your questions. And if you have anything like suggestions to improve my quality, or suggestions in future webinars, you can always reach to Adina sir about that. He might help you with that. And I'll try to improve, because after all we are all human beings. And uh, you can always there are many ebooks available, many videos are available. You can always search in internet and YouTube. It is everything is there. And as Adina sir said, you will be given these. I'll share my PPTs, and these video recordings also will be shared for you guys, so it will be very helpful for you. And I do have few images that I've taken hospitals, but I need to check. But I have some boundaries that I should not share those. But let me make an exception here. If I try to see those things, if they permit me, I will share those images. If I should ask permission from my office people. If they permit me, I will share. Or I'm so sorry if I couldn't. I do apologize for that. And anyway, thank you so much for guys for giving me such response. And it was really pleasure talking with you all. And God bless you all. And be happy as ever. Thank you. So I think that's it. Have a good day, guys.
So thank you very much, Mr. Gautam. I hope everyone get some knowledge about this particular ultrasound, basics of ultrasound and everything. And as I said before, the feedbacks and then your certificate, your e-certificates, along with your the 3 days recording video, along with that question and answer sessions, all the things. And yesterday we have a chance to take a demo of this particular ultrasound machine that Mr. Jitendra Avinash did that. That also, along with your recorded video, they will send. And then we already checked your inbox, that is, check your WhatsApp group, WhatsApp message. We sent some of the material that relating the basics of biomedical, basics of ultrasound. That will help you. That is around 45 pages. It includes so many types of probes and the types of ultrasounds and all the things there. That may help you along with that. Along with that, we will send the PPTs what the trainer will teach you on for the past 3 days. And apart from that, if you need anything, whatever the thing you might have know about these particular basics of ultrasound, we will always help to you. And thanks a lot for all the participants. And thank you, Mr. Jitendra Avinash and Priyanka, and all the other participants, those who are giving participation here. And your e-certificates and all the material what I said will reach you on or before tomorrow 5 o'clock Indian Standard Time. And thank you very much. Thank you all the participants. If I have any further webinars relating training sessions or webinar, whatever it may be, I will intimate you through the through your contacts or through your, maybe through your mail or maybe through your mobile number, whatever it may be. And thank you, Gautam. Thanks a lot for all these things. And thanks a lot for the for your sharing the knowledge, extraordinary knowledge to everyone. Thank you very much. And thank you all the participants. Thank you. Thank you a lot. Thanks a lot.